All right, so let's start off with you telling us who you are and what you do.
My name is Michael GEIST. I'm a veterinarian. I'm also the Chief Medical Officer at Green Dog Veterinary Centers.
All right, and what are we going to be talking about today?
We're going to talk about nutrition.
Let's start right off at what are the life stages of feeding my dog?
In general, we're going to have three life stages: puppy, adult, and senior. In general, they're just different nutritional requirements for each stage of life. And the puppy one, the most important thing to highlight is that a puppy diet has just different nutrients, more energy dense for a growing puppy's needs.
How would you recommend your dog off from stage to stage or just diet to diet?
In general, when changing a diet for a dog or a cat, it's better to do it gradually. It is rarely a good idea to do it abruptly because a rapid change in diet can lead to an upset stomach or some diarrhea. So in general, it's best to do a transition over 1 to 2 weeks. And I usually recommend doing 25 to 50% of the new diet with the former diet for about a week or two, and then doing 3/4 of the new diet with the old diet for about a week or two.
Do I feed my pet on a schedule, or how do I know if my pet's nutrition is lacking or suffering?
The most important thing is assessing their weight and is it stable. Another thing you can do is assess your dog's or cat's body condition. In general, if you can feel their rib cage with a mild degree, they're in a good body condition. If you have difficulty feeling their ribs, they're overweight. And if you can feel them really, really well, they might be underweight.
What are the essential nutrients that my pet needs?
The basic fundamentals of nutrition is carbohydrates, fats, and protein. So any particular diet is always going to be 100% made up of those nutrients to varying degrees. Each pet and most pet foods will have standard balances of each one, but some pets may need a higher proportion of one nutrient versus another.
How will a veterinarian be able to assess if my dog is getting proper nutrition?
Really, it's just about assessing overall parameters of health: weight, appetite, and whether there's anything like vomiting or diarrhea or general signs of just not feeling well.
When would my dog need a prescription diet?
A dog may be recommended or prescribed a prescription diet if they have a specific certain type of illness. A couple examples in dogs, for instance, would be pancreatitis. Fat restricted diet is recommended to prevent another episode. Or chronic kidney disease in dogs and cats. There are kidney prescription diets that help improve their longevity and reduce the chances of them getting sick from the disease.
Can I feed my dog human food and table scraps?
The AFCO approved diets are nutritionally balanced for dogs, and they aren't lacking in any vital minerals or nutrients. Their feeding dog table scraps, however, can lead to behavioral issues, can lead to dogs being overweight, and can also lead to GI upset with vomiting or diarrhea if there's a lot of variety or high-fat foods.
How do I know what types of food are toxic?
There are a lot of resources on the internet, and in general, when looking for the right resources, it's best to find your information from sources like universities or veterinary hospitals.
How do I know if the food I'm giving my dog is making them sick?
Well, it's going to depend on whether you're feeding the same diet for a long period at a time or if you're introducing something new. The most obvious signs are going to be if they get vomiting or diarrhea from a new food. It's difficult, or can be difficult, whether the diet that your dog has been on for a long period of time is causing them to be sick. Similar to people, there can be food intolerances and food allergies that dogs can acquire later in life, and it can manifest as peculiar or newer signs that you may not be familiar with. For instance, not just vomiting or diarrhea, but they may develop signs of itchiness or skin problems or ear infections. So those are some things that from a chronic or long-term diet, dogs can develop some issues that you may not be aware of.
If I change my dog's diet suddenly, will it cause them harm?
No, it shouldn't cause them harm. There's going to be some instances where that might be the right thing to do, but usually it's going to be under the guidance or recommendation of your veterinarian. In general, a abrupt diet change can go well in a lot of dogs or cats. However, be prepared that there may be abnormal or change in their bowel movements in the short period.
How does an elimination diet work?
An elimination diet is a treatment and a test at the same time. It may be recommended for certain types of conditions where food allergy or food intolerance is strongly suspected, and that can manifest as a gastrointestinal problem or a skin problem most commonly. So an elimination diet, it's very important to stick to strictly a new diet and that diet only, while not giving anything that has ever been given to your dog previously. So for instance, if your dog is on a current diet that is chicken-based and previous to that your dog was on lamb-based, your vet may recommend that you go on a new diet that has no allergens in it and you eliminate all previous types of foods that your dog has ever been exposed to. Very important to adhere to this because not only might this make your dog better, but it's also going to help diagnose whether the previous diet was a problem. Upon completion of an elimination diet trial, which usually is going to be about 2 months, often you might try doing what's called a challenge, which is reintroducing the previous diet and then seeing if the signs recur.
How do I know if my dog has eaten something toxic to them?
It's going to manifest with signs of vomiting, diarrhea, illness, lethargy, malaise, and in some cases, it could lead to some life-threatening disorders like kidney or liver failure.
Let's move on to some common myths about dog nutrition. Is a dog able to live on a vegan diet?
The answer is yes. There are some prescription diets that are vegan diets or vegetarian-based diets.
Is wet food more nutritious than dry dog food?
No, it just has a higher water content. So an expectation for a dog or a cat on a wet food diet or a can-based diet is that they're more likely to just not drink as much water because a lot of the water is being supplemented within the can.
Are prescription diets better for my dog?
That's managed on a case-by-case basis depending on the dog.
If my dog eats grass, does that mean they are missing something from their diet?
Dogs eating grass is an evolutionary behavior. Usually it means that something's bothering their tummy, and they'll do it as a way to purge or bring up something. It also could be a sign that they have a chronic condition as well.
Will human food make my dog fat?
If overfeeding, just like in humans, if you eat too much and it is the wrong food, then yes, your dog will gain weight.
What would you recommend people avoid as some of the most toxic foods to dogs?
You know, in large quantities, garlic can be toxic. It can affect the red blood cells. In small quantities as a seasoning, it should be okay. Chocolate is well known, and chocolate should be avoided in all dogs. A very small quantity as like a chocolate chip shouldn't harm your dog. Avocados and peaches, although the actual fruit isn't a problem, it's the pits. The pits can get lodged in their stomach or small intestine and lead to emergency surgery.
If my dog does consume something toxic, what should my first step be?
First step should be calling poison control or the ASPCA hotline. They're open or available 24/7 to answer questions about possible poisonings. They'll also then be able to give you recommendations, which often will be going to the veterinarian for therapy, for supportive care, decontamination, and potentially hospitalization.
How do I find the best diet for my dog?
Yeah, just find something balanced that fits within your budget, and if they have a stable weight and they are not vomiting and they have good bowel movements with regular frequency, then it's probably a safe and healthy diet for your dog.
How many times a day should I be feeding my dog?
You know, there isn't a program for this. Some dogs only require a feeding once a day. Some require twice or 3 times. I think just based on our regular schedules, morning breakfast and evening dinner makes sense for the majority of families.
Do I need to feed them a specific diet based on their breed or their size?
There are some diets that have been specifically formulated for small, medium, large dogs and also for specific breeds. That's not a requirement. Those are recommendations often based on nuances in their size and their breed, but it's not a requirement.
How do you feel about supplements added to food?
Most diets that are commercially available, if there is on the label that has been AAFCO approved, for the most part, additional supplementation isn't required. Having said that, any particular patient with an underlying condition may need additional supplementation with various diets. And there's a lot of different examples that could go towards this. Some examples might include B supplementation, specifically B12, or vitamin D supplementation. In some cases, you may want to add supplements like omega-3 fatty acids, etc.
What is the most important information I need to look at on dog food bags when looking at ingredients or nutritional values?
The first thing you should do when looking at the ingredients are the first few ingredients, because that's the primary ingredient. So you want to make sure it fits with your values for nutrition and what you want to feed your pet. And for the most part, the first few ingredients is in high quantity. So if you don't like what the first few ingredients are, then you should find another diet.